Dear students, you are welcome on Learning with L&R, and today I would like to talk with you regarding the new disorder, that is cerebral palsy. First of all, the introduction. Cerebral palsy is actually an umbrella term for several different types of physical disabilities. The term cerebral refers to the area of the brain that is affected by the disease, because this disease related to the brain. The disease often includes other connections in the brain involving the cortex and parts of the cerebrum as well. The term palsy refers to the disorder of movement. The meaning of cerebral and palsy: cerebral, affected part of the brain, and palsy, lack of muscle control. The muscle present in the brain, when they weak due to any problem, the term known as cerebral palsy. The definition: a condition marked by impaired muscle coordination or other disabilities, typically caused by damage to the brain before or at birth. If we talk about the incidence, then 4% of the newborn per 1000 live birth suffering from this. 10% of infant born with very low birth weight, that is 1000 gram or less at birth. Then 5 to 10% incidence in preterm babies. If we talk about the birth asphyxia, then it caused 3 to 21%. Then next is the types or classification of cerebral palsy. The most common form of cerebral palsy, 60 to 70% of all people with the condition are affected by the type that is based on motor deficit, movement disorder, and have stiff and awkward movement. Depending upon the involvement of spasticity, the name accordingly given to the cerebral palsy, like monoplasia. It means affects one limb, usually an arm, and in case of hemiplasia, affects one side of the body, that is leg, trunk and arm. If we talk about diplasia, in case affects either both arms or both legs. In case of quadriplasia, affects all four limbs of the body. Then extrapyramidal cerebral palsy, also known as dyskinetic cerebral palsy. It is found in about 30% of patients of all cerebral palsy. The types we talk about, all type, the patient suffering from the cerebral palsy, 30% of patient in dyskinetic cerebral palsy or uncontrolled interfere with speaking, feeding, grabbing, reaching and other skills that require motor skills, and it caused by cerebral damage due to curvatures. Curvature terms you know as very well. Atonic cerebral palsy, found in about 5% of all CP patient, and poor balance and lack of coordination present in this results in stumbles and falls due to there is tone absent or the balance is not there. That's why the patient fall. Ataxia and tremors appears by the age of 2 years. If we talk about mixed form, spastic muscle tone and involuntary movement are there, have damage to the motor cortex and cerebellum. Then motor type. If we talk about the motor type, then there are spastic 70 to 80%, dyskinetic 6%, mixed type are there, and ataxic 6%. In spastic, most common form, this is the most common form, and muscles appear stiff and tight in spastic. It arises from motor cortex damage. And if we talk about the dyskinetic, that is contribute 6%, characterized by involuntary movements and arises from the basal ganglia damage. And in case of ataxic, it is also 6% contribution, characterized by shaky movements. Involuntary shaky movement affects balance and sense of positioning in space. and it arises from cerebellum damage. It means the different area of the brain, when the different area of the brain muscles affected, then these kinds arises due to that. And the most common type, that is spastic. And if we talk about the mixed type, then all three kind are present in that. According to severity, mild cerebral palsy, that is 20% cases, patients are ambulatory, fine movement are impaired only. If patients suffering from this, 20% of brain muscles are involved in this, then the fine movement are impaired due to this. And in case of 50% cerebral palsy are there, then we count in under the category of moderate. These children achieve ambulation by self-help. There is impaired gross motor, fine motor and speech development. If you talk about severe cerebral palsy, 30% cases are there. The child present with multiple defects and unable to perform usual activities of daily living, this kind of child need help in every step of life or daily activity. If we talk about the clinical manifestations, then early signs of cerebral palsy, that is asymmetric movement. The movements are not, the coordination is missing actually. Restless, irritable, child feel irritable. There are feeding problem, swallowing problem and poor sucking while feeding. There is poor head control. According to the age, the child unable to control their head. Tongue thrust, excessive high pitch cry or slow weight gain. Slow weight gain are present in this. Late signs of cerebral palsy, delayed gross motor development, persistent infantile reflexes, weakness are present, abnormal postures, drooling present, recurrent infections, malocclusion of teeth, constipation, caries teeth, delayed or defective speech are there, evidence of mental retardation. If we talk about the management, how we manage this patient, ways to help the cerebral palsy child live a better life. In case of medical management, correction or elevation of specific neuromotor deficits or associated disabilities, symptomatic management is done. In case of pharmacotherapy, diazepam we provide for spasticity, strychnine for hypotonia, levodopa for acetosis, carbamazepine for dystonia, anticonvulsants for epilepsy, tranquilizers for behavioral problems, and muscle relaxants to improve muscular functions. Physiotherapy also provided to the child so that they can improve or rehabilitate. Development enrichment experiences, development of vocational and socializations, emotional behavior and social adjustment. Some surgical management also given to the child in case of the condition demand. Orthopedic correction under this, scoliosis, contractures, dislocations, rhizotomy is an attempt to decrease spasticity.